is preparing to have a briefing about the coronavirus pandemic. We're going to go ahead and take you there now live for this breaking news.
Health Authority, Texas Tech University Health Sciences Center. Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Michael Lementier, Chief Medical Officer for BSA. Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We'll go ahead and turn over to the panelists for statements, and then we'll take questions from the media. This time, let me go ahead and turn it over to Amarillo Mayor Ginger Nelson.
Good morning, Amarillo. I hope you're having a good week. I wanted to visit a little bit this morning about what we've learned so far. We've been doing this now for several months. And when COVID arrived in our community, there was a lot about COVID that we didn't know. There's still a lot about COVID that we don't know, but we have learned some things. And I wanted to make some points on that this morning. I think the most important thing that I've learned is that our behavior choices affect our spread. Our spread affects our hospitals, and our hospitals are what save lives. And it's not just the choices that we as Amarilloans are making, but truly we're individually making choices that keep our hospitals open and operating for the entire panhandle. So the choices that you and I make here in Amarillo about social distancing, about not getting too close to other people, about not attending large gatherings, wearing a mask, obviously washing your hands and staying home if you're sick. Those are the things that keep our hospitals where they need to be in order to protect not just Amarillo, but the entire panhandle. And so that's something that we've learned. And having visited with our friend, the mayor down in Lubbock, Dan Pope, they're having a spike in Lubbock right now. They've really tied it to just a couple of locations where people were not maintaining social distance. And so it is that important. Yes, we're going back to living life, and we should be doing that. But we can't do it outside of a COVID mindset, not yet. So I'm asking you, go back wisely. We seem to be doing it well here, but we have some occasions coming up. Juneteenth. This weekend, we'll all be celebrating what that holiday stands for, both in its past and in its present. There will be, I know, some rallies planned in Amarillo, and I hope you'll get out. I hope the weather will be beautiful. You'll get out and join those rallies and keep them peaceful. But I hope that you also maintain your distance from each other, be wise about wearing your mask and using your hand sanitizer, because the choices we make as individuals are what affect our city, affect our hospital, and affect the entire panhandle. Thank you, Dave.
Thank you, Mayor. This time, let's go to Casey Stoughton, Public Health Director, City of Amarillo.
Good morning, Amarillo. Generally I start with a kind of a compilation of the numbers that we've seen in the last day, but I did want to echo what the mayor said. Our behavior directly impacts the curve here in our community. Currently, in Amarillo, we're maintaining our plateau of cases. However, we are watching the numbers closely. South of us in Texas, other health departments, the state health department, are reporting increases in cases. As people are moving about and are experiencing new exposures to COVID, they're seeing those increases in cases. And so I encourage us to use extreme caution. We're in level orange, and that denotes to use extreme caution as we're moving about. So please, wear a mask. It's the wise thing to do. Mayor Nelson said that just exactly spot on. And so I certainly encourage us to do that. It's a very sensible thing to do in West Texas. I think the sensibility is what gets us where we are, kind of that panhandle spirit. So I think that doing those sensible things will keep us safe. So for the numbers, as of yesterday, there were a total of 3,561 cases of COVID-19 reported in Potter and Randall counties, 2,798 in Potter County and 763 in Randall County. We have a total of 1,717 recoveries and 44 deaths reported in our community. That leaves us with 1,800 active cases. There will be a change in our report card reported at 2:30 today, so be looking out for that. Each of the cases do represent a unique individual. We have people who test perhaps multiple times, but those multiple tests are not reported in the case count. So I think that's important for you to know. This week, we'll be moving to a Monday through Friday only format in our report card. So you won't see a report card or a dashboard update on Saturday or Sunday, and that will be moving forward. Our department and the fire department have finished testing at the nursing homes, and so far we've tested 2,301 staff and residents at the nursing homes. We've had 93% of those test results come back negative, 6.4 were positive, and we do have 0.6 of those 0.6% of those test results pending. There are 14 nursing homes, and 12 of the nursing homes have COVID positive, either patient, residents, or staff positives identified in those nursing facilities. Assisted living facilities and group homes, we still anticipate an order from the governor's office. However, we've been proactive in testing those facilities. So far, 1,008 residents have been tested from assisted living and group homes. So far, 97% of those test results have been negative, 2.7% positive, and 0.3% are pending. We appreciate the support from the Amarillo Fire Department. They've done an outstanding job. We've not received additional lab results from JBS from last week. So far, we have a total of 812 residents from Potter and Randall County who work out of the JBS plan that were tested. 62% of those test results were negative, 22% positive, and 17% remain pending. And that's all I have today, Dave.
Thank you, Casey. This time, let's now go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Milton, how are you?
I'm fine. Can you hear me?
Yes, we can.
Good. Yes, I just wanted to reiterate what Mayor Nelson and Casey have stated. That's just our behavior is just so important, and trying to maintain social distancing and wearing a face mask is really the only way that we can really mitigate the spread of COVID. We've said this for several months. As far as medical treatments, there was an important study that came out just yesterday that showed a very common drug that's used in the hospital. It's a steroid. It's called dexamethasone. Actually shows a decrease in mortality when it's used in patients with severe respiratory symptoms. So this is an immunosuppressant drug that probably helps blunt the immune response. That's the use of dexamethasone for severe infections is not new. There are other types of infections that have shown benefit from receiving steroids, and specifically one of those is a type of bacterial meningitis. So we're going to be utilizing that in our hospitals, I think. Remdesivir use is also ongoing, as well as convalescent plasma in our hospitals. We're continuing to tabulate those results, and we'll follow them. And otherwise, I think that one other thing I wanted to add was that we did have some astute medical students who showed me an observational study they'd done at a grocery store over a period of weeks last week. And I just wanted to comment on that. It was very clear that there was a decreasing trend in people that were wearing masks. So the percentage of people of individuals that were walking into a grocery store from mid-May to early June showed a significant decrease in the wearing of masks. So please, let's try to turn that trend around. I think that's very important so we can all stay safe. And that's all I have, Dave.
Thank you, Dr. Milton. This time, let's go to Dr. Brian Weiss, Chief Medical Officer, Northwest Texas Hospital. Dr. Weiss, how are you?
Oh, doing well. Thank you. Good morning. So we at Northwest are starting to see some semblance of normalcy returning, which means, once again, we're having a ridiculous number of meetings every day. I'm not sure I'm happy to see that return. But anyway, we, as in most organizations, are stuck in this COVID limbo of, do we have the meetings in person? Do we have them on Zoom? Do we wear masks? How far apart do we separate ourselves? But I just want to reiterate what you've already heard from the mayor and Dr. Milton, which is, when in doubt, do the right thing in terms of wear the mask, keep the separation. Now is not the time to reduce our vigilance. as we've seen the other hotspots now appearing around the state of Texas. In terms of the numbers, so right now, today we are at 7 COVID-related patients in Northwest. 2 of those are in the ICU, but neither is requiring a ventilator. So really, the numbers look great. We are recognizing that we are receiving some patients coming in that we have to have a little higher suspicion for a possibility of COVID. Namely, we're seeing some patients coming from the Texas Department of Criminal Justice, where we know that they're still having some issues with some of the positivity there. In terms of the hospital, we continue to relax some of our visitation restrictions. Right now, it's still 1 visitor per room between 12 and 8, except for L&D, and now on pediatrics, we're starting to allow two visitors per room on pediatrics. The good thing is we're starting to see our ED volumes going up. Before COVID, we were typically seeing upwards of 140 patients a day in our main emergency room. Right now, we're in the low 100s, but the ER docs are telling me they're seeing a lot of patients who are quite sick, so a high acuity. For some of these, it probably means that these people waited a little longer than they should have to come in and seek care, but we are happy to see them coming back and getting the care they need that may not be COVID related. Also, surgical procedures continue to go up. So I think, just to reiterate what you've already heard, is for Amarillo, we need to continue to be vigilant, particularly as we move about the city. We go to the grocery store, wear masks, keep the distance, because it's just so easy to reignite this issue. So that's all I have for this morning. Thank you.
Thank you, Dr. Weiss. This time, let's go to Dr. Michael Lementier, Chief Medical Officer for BSA. Dr. Lementier, how are you?
I'm good. Good morning, everybody, and thanks for letting us join on the conference today. I think for BSA's update, I want to start off with some statistics. We're currently at 12 patients confirmed in-house today. Over about the past 2 weeks, we've been hovering in that 12 to 14 patients confirmed range. And as it's been shown, at least for our experience since the beginning of the pandemic, about 50% of those patients have been requiring the ICU, and about 50% are in our medical surgical unit. Currently, we have 7 of those 12 in the ICU. 1 is a pediatric patient. 5 of the ICU patients are on the ventilator at this time. We have not been able to drop into single digits in terms of our confirmed cases in the hospital. We have very few patients beyond that under investigation because of our rapid test kits that we have with the PCR testing. We're able to turn those answers around very quickly when we have a patient that we suspect could have a COVID infection. We're still seeing a fair amount of patients come through our respiratory triage unit, which is a separate unit in our ED. About 20 patients a day we've been having consistently come through that unit. Obviously, those are not all COVID concerns, but we're attempting to segregate those patients so that we get an appropriate demarcation if we think that patient may have COVID, so we can keep them isolated. At this time, we're using just a little bit over 50% of our ventilators in-house. We are also seeing a ramp up in our general hospital volume. Our census today is back close to really what our average daily census is, and most of those are non-COVID patients, obviously. We have started to open up again in terms of our elective procedures and surgeries that are in need to move forward, obviously. And our pre-admit testing protocol, I think, is a very good one. Again, we reviewed the latest evidence with our medical executive committee this week. I did that with our physician leaders, and we really feel like the protocol we have in place is a good one. Less than 1% of the patients that we're testing for COVID pre-op are coming back positive. And now we've done almost 1,000 of those tests. So we're very happy that we're not seeing a lot of positives in that preoperative population, which, by the way, is a population of patients that we need to be careful about when we're moving forward with a procedure, because it does appear that there's some increased risk for certain patients going for surgeries, which again goes back to our protocol that we need to make sure we're being diligent about. Beyond that, we have opened up visitation, as I mentioned, last week on June 8th. And in doing so, we're still limiting visitation to 1 visitor per patient, except in certain circumstances where it's important to have that be two visitors. And we're doing that and trying to be as careful and as compassionate as possible. We're doing things to make sure that with visitation being augmented, we're keeping things safe. That is extra cleaning with our EVS staff for high touch areas, continuing with our universal masking policy, continuing to screen all employees, medical staff members, and visitors that come to our facility to ensure that no one is coming in with symptoms or findings that may suggest that they have infection and they don't know it. And then lastly, what I'd like to say is that from the treatment standpoint, as Dr. Milton mentioned, we are continuing with remdesivir. We've treated 7 patients to date. We have enough remdesivir to treat probably about 40 more patients, depending upon the duration of course they get. We also have been using dexamethasone since the outset. Our physicians that got a panel together and looked at some of the benefits of using dexamethasone in ARDS patients decided that this was something to consider doing. And I think now having some evidence that this may be helpful with some data behind it is even additionally a positive thing. So we're happy to see that coming forward. And I expect we're going to continue to see these data points come out in additional trials as we move ahead in the next upcoming months when we get better trials and not just some of the retrospective data we've had to really kind of sift through. So that's BSA's update today, and I appreciate the time to speak.
Thank you, Dr. Lamentier. Let's now go to Dr. Rodney Gonzalez, the relatively new director of the Amarillo VA. Dr. Gonzalez, how are you?
Hold on. Okay, I'm doing well. Can you hear me?
Yes, we can hear you. How are you?
Okay, I'm doing great. Good morning. Thank you for this opportunity to speak. First of all, we'll look at our numbers, and I will tell you, looking at our COVID cases in the Amarillo VA and our outlying clinics, which include, as you know, Lubbock, Clovis, New Mexico, Childress, and Dalhart, we continue to see a reassuring trend. We currently have 0 positive patients in our hospital. We are monitoring 14 positive cases that are self-isolating at home. And we have no veterans who are awaiting COVID-19 test results. We are happy to report we still have the 4 veterans who have recovered from COVID-19. Now, as we continue to see this stable trend, both internally and in our community, we are looking at reopening our Amarillo campus to face-to-face appointments. And tentatively, we've scheduled this for the 6th of July. Now, to ensure a safe environment for our veterans and staff, we will only have a limited number of appointments at the beginning, but we will continue to have our virtual and telephone appointments available throughout. To schedule an appointment or discuss the best appointment options for you, you can call us at, and I'm gonna give a phone number here, 806-355-9703, and press option 2. So once again, that number was 806-355-9703, press option 2 to discuss and schedule face-to-face appointments for after 6th July. Now, we recently, last week, we had a telephone town hall with our veterans, and what they told us is they are ready to start seeing our providers in a face-to-face setting. However, they still want that ability to have the virtual health options, and so that's what we are going to continue. Now, as we adjust to our new normal, our Amarillo veterans will have the opportunity to hear how the Amarillo VA leadership team describes our plan for beginning these face-to-face appointments on June 25th. And I look forward to having a conversation with you, our veterans in the Amarillo and surrounding community, and to answer questions you may have regarding our return to face-to-face visits. So once again, I want to just state those dates I mentioned earlier. June 25th will be the Veteran Teletown Hall, and July 6th is our tentative date for reopening face-to-face appointments at the Amarillo VA. You know, not in my notes here, but I do want to reiterate what Mayor Nelson said with continuing to be vigilant and watch the social distancing and wearing your face mask when you're out in the community. I'd like to thank Mayor Nelson, the City of Amarillo, for allowing me the opportunity to speak to my fellow veterans in the Texas Panhandle. And I want to thank you, the entire City of Amarillo, for your tremendous support you have given to our veterans and our Amarillo VA team during this pandemic. Thank you.
Thank you, Dr. Gonzalez. Now I want to go to City Manager Jared Miller. Jared, how are you?
Doing good. Thank you, Dave. I want to remind everyone about our new emergency notification system that's designed to provide current and factual information on a variety of events, including COVID-19. I want to encourage everyone to continue to sign up for the service at amarilloalerts.com so that you can stay informed. As of this morning, we have 6,443 people signed up for the alerts. The drive-through testing center remains open. If you feel sick and you have symptoms you think might be COVID-19, call the public health hotline at 378-6300 to be screened for the drive-through testing center. We remain under phase 3 of reopening under the governor's executive order GA-26. This includes not only Amarillo, but all of Potter and Randall counties as well. One of the final stages of phase 3 begins on June 19th, when amusement parks and carnivals in Potter and Randall counties will be able to open at 50% capacity. Calls to environmental health regarding complaints about businesses not complying with the governor's executive orders are dropping to very low numbers. We're now receiving one or two calls a week, and we continue to follow up on all calls. The building safety department is open and following social distancing policies at the Sims Municipal Building. Utility billing department is accepting walk-ins at Amarillo City Hall, adhering to social distancing policies. Utility billing and vital statistics customers can also utilize curbside payment services. Anyone wishing to utilize the service should enter City Hall parking lots from either Buchanan to leave payments in the drop box, or from Johnson Street to pay by credit card. We've had a number of days of high wind lately, so inclement weather like high wind or things like that can keep us out, can prevent us from being able to provide those curbside services. So in those cases, if you don't see those curbside services being offered, we're still offering all services inside. All city departments are going to begin opening for walk-in traffic when we move to condition yellow, which will happen at some point, we anticipate in the next few weeks. We are also going to begin in July resuming normal operations for utility billing. Throughout the heaviest portions of the coronavirus outbreak, we deferred payments for people that needed to. So we're going to be working with customers in utility billing to make sure that they have a payment plan that will work for them. So we'll be resuming all normal operations and activities with utility billing beginning in July. We're also going to begin normal operations with downtown parking for both timed parking and paid parking beginning in July as well. That's all I have, Dave.
Thank you, Jared. At this time, we now want to open it up to media. We have a question.
I think we'll continue with the latest coronavirus coverage on air and online, and to keep up with that latest, you can visit our website at myhighplains.com. Well, for now, we'll go ahead and send it back to regular programming.
The City of Amarillo has seen, I guess, an increase in tests or an increase in positives of coronavirus related to younger individuals here in this community.
So our highest numbers of cases have traditionally been in younger age groups. I think, in fact, I did the math yesterday, 60% of our cases are between the ages of 20 and 49. And so while that's kind of a wide age range, it highlights the fact that the largest number of cases, of positive cases, are in the younger ages. I think and that does speak to the fact that I think they move about more. I think that it's important for everyone to wear a mask. It also, our highest mortality or our deaths are in the higher age ranges. So those people 60 and older. And so again, it's so important that everyone wear a mask and that we work to protect each other.
Absolutely, absolutely. And I guess this is a question for the panel. I mean, with the recent increase in Lubbock, does that, I guess, change any approach or any conversations regarding the coronavirus here, because it's only about 120 miles south of us?
So we're absolutely watching that. We want to, the only way we can flatten the curve is for us all to work together. And to work together, we have to wear masks. We have to stay 6 feet apart. We have to limit our social groups to small groups. We are seeing at the very beginning of the COVID situation here, we had sporadic cases, and then we saw larger outbreaks and clusters, and those are generally easier to work from a public health perspective, because where those exposures are, kind of what that looks like. And now we're kind of going back like we were in the beginning, where we're seeing more sporadic cases, not as much clustering. And so, so we're definitely watching what's happening across the state, and we're going to have to all work together to make sure that we keep our curve flat here in Amarillo. We've all worked very hard to do that. We've worked very hard to protect hospital capacity, and we have to make sure that as a community, we continue to do that.
And I'll just jump in and say, I'll just challenge us as citizens, as churches open, as we start doing weddings and funerals again. We're back to doing more birthday parties and backyard picnics. These are the situations that it's so tempting to us as people to reach out and give someone a hug. And we're hungry for it. We've missed those friends, and we've missed being able to do that. Those are the type of behaviors that will increase our spread. So can we safely go to church together? I believe we can, but it will depend on our choices. We can't go back to living exactly the way we were until we have this figured out. So we're asking you for a little bit more time as an individual. Just hold back, do that elbow bump, do the air hugs. Get creative in how you want to express that, but please be mindful of every time you hug, every time you handshake, you're increasing the risk of that person as well as the people throughout our city. It's not just about you, it's about all of us being in this together.
Thank you, Barrett. And I guess my last question, and I'm going to embarrass myself here. I was wondering, what patients are the ones who are receiving the dexamethasone treatment, and kind of, can you tell me a little bit about, once this treatment is given, kind of what is seen from the patient if the treatment is working?
I'll comment on that. The study showed that it's useful to use that drug in patients who developed respiratory distress, and so they have to be requiring oxygen in significant amounts. And so that drug is a steroid drug, and it's an anti-inflammatory drug. And so it tends to block the immune response that gets out of control. The term that's been used for this is what's called a cytokine storm. But so what we hope to see, and I think what the studies have shown, is that you have less of an immune response, and it gets blunted, and therefore the outcome seems to be better. As I said, dexamethasone's been used in other types of severe infections before and has shown a decreased mortality and morbidity, specifically in a type of bacterial meningitis called pneumococcal meningitis. So it's not terribly surprising that this drug may have some benefit, I think. Is that helpful?
Yes, it is. Any comments on that from the hospital representatives in the room?
No.
Yeah, I would agree. I was going to say, I would agree exactly with what Dr. Milton said. This has been shown to be effective in other serious infections. Meningitis is the hallmark example. And again, it's for patients that are more severely ill, trying to block the immune response. And again, to say specifically, what our outcomes have been, I think in retrospect, when we're able to look at and collate all our data, we'll be able to hopefully see those patients that we treated with that drug versus others, what percentage of those did better. And then certainly the larger numbers of patients in the trials that are national and international will give us the best response, because they'll be powered to help us make those future decisions.
Yeah, and I would say, David, I think as Dr. Milton said, what we've seen is, it's been suspecting COVID, is that the problem is not so much the virus, it's the immune response to the virus that is what gets these patients in trouble, and particularly with the what they call adult respiratory distress syndrome, ARDS. And so, yeah, I find this very encouraging that this dexamethasone, which targets trying to limit that immune response, is proven to be so helpful in these patients.
Absolutely. That's all the questions I have. Have a good rest of your week, y'all. Stay safe.
Thank you, David. Let's now go to Aaron Langston, KAMR Channel 4. Aaron, how are you? Good.
Well, I think as a physician, and Brian and Mike can certainly add to this, I think we're always trained to be cautious and generally worried individuals. So, I think I remain concerned about having a surge or an increased number of cases. That being said, we're somewhat battle hardened now. I think we kind of know more about this illness, and not only that, we seem to have the resources at this point to handle a surge if we unfortunately have to have something like that. And we know how to mitigate this, right? We know, and so if we can practice social distancing and wear a mask and try not to congregate in areas that we've talked about previously. I also want to mention another place that I think is maybe part of the problem is Lubbock is a bar, and specifically college students hanging out at the bar and not practicing their social distancing. I think that's another area that needs to be monitored.
No, I think right now those are pretty much wrapped up. If we see that we have a need for that, then we can always bring that back. But I think right now those are generally wrapped up.
We're getting very, very few calls right now regarding non-compliance with the governor's orders. So it appears, and it's subjective, and we only know what's being reported to us and what we see when we inspect. But it appears that people are complying with the orders in Amarillo.
Thank you, Aaron. Let's now go to, if I'm not mistaken, Ariana Martinez of News Channel 10. Ariana, how are you?
Morning, everyone. I'm good. When will the city make decisions on small business economic aid options that was discussed yesterday?
We'll have that in front of council next week for consideration and approval.
Awesome.
Just to summarize, Ariana, there'll be two different programs coming out of the city. One will be for businesses that qualify under a low to moderate income standard. Either as a business owner, you meet that criteria, or you employ people who fit in that category, then you would be eligible for some funding. A second category doesn't have any restrictions on it as far as the type of business, and that would be, so it'll be citywide, and it's a reimbursement program that if you spent money on any type of public safety need to prepare your business, like masks for your employees so that they could safely interact with the public, or you installed shields between your cash register checkout stations, those type of expenses, a portion of those can be reimbursed if you fill out the application and qualify for the program. So those are two different programs that we're rolling out, one targeted to low to moderate income businesses, and then the other one targeted to every business in our city, just trying to help businesses get back on their feet. Obviously, we know it's not enough, but it is something, and we just want so badly to help business owners in our city.
Perfect. Thank you for explaining, Mayor. When will the city be changing its testing site, and where will that be?
So we'll be moving from the fairgrounds, and we appreciate the generosity of the fairgrounds. Virgil and his team have been just outstanding to work with, and we've been there since March 27th. It seems like an eternity. It's been less than 3 months, and so we'll be moving from the fairgrounds to a city-owned property in the downtown area. I don't know the exact address. I'm sorry. I think it's around 9th, and I'll have to get the exact address, but it's a city-owned property, and we'll probably be moving there in the next week or two. So we'll give exact details as soon as we move. But the way it works is when people call the public health hotline at 378-6300, then we give them those specific details on where to go. And so people will know exactly where they need to go when they call us.
Perfect. How close are we to changing from status orange to yellow, and what conditions will that require?
So right now we're in status orange because we're at a plateau. When we start to see a decline over a period of time, then that would indicate that we can move to status yellow. I don't believe we're there yet. Hopefully we'll be there in the next like Jared mentioned, in the next few weeks. I think if we can all pull together and wear our masks and socially distance and wash our hands, then we could get there sooner than if we don't. And so it's up to all of us in Amarillo to get us to status yellow sooner than not.
Yeah, and as we've been considering that, I didn't want to create any false sense of expectation when I said that. The key there is that we need to have a continued decline in cases, a continued recovery in this area. As we see that over a period of weeks, then we can justify going to a reduced posture from orange to yellow.
Perfect.
Still going to require social distancing, still going to require responsible behavior, still going to require enhanced sanitation and face masks and everything else. This is going to continue for some time, but our movement from orange to yellow is going to require continued decline in number of cases.
Perfect. Thank you for explaining that. This one's probably for Dr. Weiss. Do you know how many patients we have in the hospital from TDCJ?
Not exactly right now. I know at least one of the 2 patients we have in the ICU is from TDC. So we typically have at least 1 or 2 TDC patients in the hospital at any given time, who have been diagnosed with COVID.
I can answer that. I was rounding this morning. I think it's 5. And there are 2 of those individuals that are COVID positive.
Perfect. And then last one, probably for Mayor Nelson. We saw that there was 9 mayors in Texas asking Governor Abbott to be able to allow them to make their citizens wear masks. Is that something you're considering asking Governor Abbott as well?
I did not sign the letter that was circulated by the big city mayors in the state of Texas. I believe our community values the right to choose and individual responsibility. I'm asking citizens to wear them. I think it's good for our city. I think it's good for our hospital capacity. Again, it's not about whether or not you're afraid of getting the virus. It's whether or not you're unknowingly transmitting it without any symptoms to someone that it would be very costly for them to get the virus. So I'm not in favor of a citywide mandatory order that citizens would wear masks. I'm much more in favor of the culture that comes naturally to us as Amarilloans, and that is think of others before yourself. And if we'll take that stance where we're honoring others, we're respecting others, we're thinking about what others' needs are in front of our own needs, then I think that equation leads us back to being willing to wear a mask. And yes, it feels awkward. Yes, it is sometimes uncomfortable having that covering on your face. It's even socially awkward because it's hard to hear people and you can't see people smiling. But this is temporary. And it's something we're doing for each other to take care of each other. And it's not a permanent thing, but it's what we need to do right now. It's a good individual, responsible thoughtful, caring choice. And I don't know anyone who lives in Amarillo that doesn't want to wear those labels as a neighbor, as a friend, and as a citizen.
Perfect. Thank you. And that's all I have today.
Thank you, Ariana. Let's now go to Paola Oberon of Telemundo, Amarillo. Paola, how are you?
Good, and you?
We're good.
Good. Okay, my question will be related to Governor Abbott stating that more people under the age of 30 are testing positive. This may be because people go to bars. So my question is, are employees at bars here in Amarillo required to wear masks, or is up to the owners of those bars?
Those are recommendations included in the governor's plan for reopening Texas. They are not requirements. So they are recommendations. It is a best practice that's recommended by the Department of State Health Services and included in the governor's orders. But we don't have the ability, and the health department and the environmental health department and the public health authority don't have the ability to require masks by employees in those situations.
Okay, that was my question. Thank you very much.
Thank you, Paola. At this time, that concludes our news conference for this Wednesday. Once again, we do these every Wednesday at 11 a.m. I want to thank our panelists for taking the time today to provide this important information to our community. This is David Henry. I'm the Communications Manager for the City of Amarillo. We'll see everyone next week. Thank you.
Thank you.
Thank you.